Welcome back to WBRZ News 2 at 4. Dr. Stevens is here today, and we're talking about non-invasive procedures that can sort of give you a refreshed look.
Refreshed look, and maybe that's the point. I think a lot of these new techniques that we have are wonderful for fine lines and maybe a little bit of loose skin. But if we have a lot of sagging skin, especially around the neckline, around the jowl, then all these non-invasive techniques are not the answer. And I think that I see so many ladies that are coming in, they're looking for, the quick fix, the non-invasive techniques, and they're just not there for a lot of sagging skin. And unfortunately, surgery is probably the best avenue for that. And then potentially, using some of these non-invasive techniques for some of the fine lines after that, I think is probably better money spent.
So how do we
Well, the key to this is first off, the diagnosis, okay? We need to find out exactly what they have. And so if they have a lot of the sagging skins we've talked about, then potentially surgery is the way to go first, and then some of the non-invasive techniques, fillers, some of the lasers and ultrasound work fantastic for that. But if you have a lot of sagging skin, then we need surgery.
All right, I think we have some pictures to show.
Yes, the example right here, this is a lady that, you could bathe in Botox and it's not going to fix some of the sagging skin. This is a surgical problem. And so you can see after surgery, the neck looks great, and then some of the fine lines using some lasers and things. Another example, a lot of sun-damaged skin, a lot of sagging skin, and this is after a facelift.
Oh, wow.
This is surgery, and so that's the answer. And it's not lasers and it's not ultrasound therapy. It's just too deep tissues. The muscles have all been subject to gravity and changes over time, and it just needs to be refreshed. And the only way to do that is with a surgical incision.
Okay, great. So what other products are there besides?
Well, ultrasound is a great technique that's being used, as well as some lasers, and even the old-fashioned skin peels can help with some of the fine lines. And so there are a lot of methods and modalities out there that we have. We just need to know the correct diagnosis for the patient and point them in the right direction. And really, we see a lot of marketing out there, and I see a lot of people that have spent a lot of money when surgery is probably the best avenue for them.
Okay, thank you so much, Dr. Stevens. We appreciate it. You're watching WBRZ News 2 at 4. We'll be right back.